Hi, my name is Maureen Sue. I'm a professor at UCLA and a member of the Medical Advisory Board for GBS-CIDP. Today, I would like to tell you about 6 research awards that were funded by the GBS-CIDP Foundation. There are 2 Discovery Awards and 4 Elevation Awards that were given in 2022, and they are all very exciting. The first of the Discovery Awards was given to Dr. Pietro Emiliano Donadu, who is at the Humanitas Clinical Research Hospital in Italy. And his title is the Dissecting the Genetic Architecture of CIDP. What he's going to do is to try to understand the genes that are important for predisposing to CIDP development and to try to understand how some of these genes can result in different clinical manifestations and different immune responses. The second of the Discovery Awards goes to Dr. Ruth Lisinga and Professor Bart Jacobs, and they are at the Erasmus University in Rotterdam, Netherlands. The title of their project is The Pathogenicity of Human Antibodies Cloned from Guillain-Barré Syndrome Patients. And what they're going to do is understand how a particular type of antibody that they found in Guillain-Barré patients that reacts against GM1, so it's called an anti-GM1 antibody, whether or not these are pathogenic and how they can cause disease. So the 4 Elevation Awards, the first goes to Dr. Moritz Kronlage in the University of Heidelberg in Germany. And he's going to be using MR neurography in chronic inflammatory demyelinating polyradiculopathy, or CIDP. So what he's going to use is magnetic resonance neurography as a new way of trying to assess nerve integrity and therapeutic responses in CIDP. And this should be a new, potentially a new way of trying to diagnose and characterize CIDP patients' nerve activity. The second of these Elevation Awards that's funded by the GBS-CIDP Foundation goes to Dr. Yonis Petropoulos from the Cornell Medicine in Qatar. And their project is entitled Corneal Confocal Microscopy, an objective imaging marker for immune activation and neurodegeneration in Guillain-Barré syndrome. So they're also using a new technology, which is this corneal confocal microscopy, to try to understand how the nerves in the cornea may also relate to the development of GBS and other GBS subtypes like AIDP, AMAN, and MFS. So this is important because it's a new way to try to assess how the nerves may be damaged, as well as trying to use it as a diagnostic. The third of the Elevation Awards that was funded by GBS-CIDP Foundation goes to Dr. Eileen McManus in the Waikato Hospital in New Zealand. And the title of her project is The GBS Phenotype in New Zealand, How Ethnicity, Socioeconomics, and Infection Influence GBS Outcome. So they are looking at the social and ethnic factors that might influence how patients with GBS fare during their disease, and whether or not the infections that are associated with GBS may also have an influence. And finally, the fourth of the Elevation Awards goes to Dr. John Philippe Hamda Sanchez, who is a MD PhD at the University Hospital of Saint Etienne's in France. And the title of his project is Revealing Autoantigen Repertoire of IVIG Responders versus Non-Responders with CIDP. So this research project that's also funded by the GBS-CIDP Foundation is going to look at why certain people do better with IVIG than others, and whether or not the people who do not respond as well may have more immune responses against different antigens. And so by antigens, we mean pieces of the nerve that the immune response is reacting to and attacking. So what they're going to do is try to identify what those targets on the nerves are as a way of trying to understand response to therapy. All right, these are all really exciting awards that were funded by GBS-CIDP Foundation. And I am so glad that we are able to participate in funding this research.